Just as we thought it might be safe to go out, there is another threat I just want to bring to your attention, and it's right where some of us may be escaping to in the good weather. And I'm talking about woodland. I'm talking about ticks and a disease that some ticks can carry. It is called Lyme disease. Julia Knight is from Lyme Disease UK. Good afternoon, Julia.
Good afternoon, Andy.
Well, first of all, what is Lyme disease? It's Lyme, isn't it? Not Lime. What is Lyme disease?
So Lyme disease is named after a place in Connecticut, Lyme, Old Lyme in Connecticut, so not Lime. And Lyme disease is a bacterial infection that's contracted if you get bitten by an infected tick.
Okay, how is it spread? And the other thing is, how seriously should we take it on the Isle of Man, do you think?
Well, I think anyone, anywhere should take it seriously because it is becoming more and more prevalent in all areas. So it is really important to be aware of it and know, A, how to prevent it if at all possible, or what to do about it if you do get bitten. It's also important to remember that not all ticks carry the bacteria, so a tick bite isn't a given for Lyme disease, but the fact is they don't carry a label saying I'm infected, so the best thing to do is prevent a bite in the first place.
Okay. If you see a tick on your skin, though, and first of all, just describe to me, what is a tick? If you see one on your skin, how do you get rid of it?
Okay, so it's really important. Ticks can be as tiny as poppy seed. So they often get missed, but as they feed, they grow, and they can grow as big as a baked bean size, but people do miss them on them, and that's why they don't realise they've been bitten. But if you find one on you, it's really, really important to remove it correctly, and that is either with a tick tool, which you can get from sort of country shops, vets, or a pair of very fine nose tweezers, not the kind you do your eyebrows with, a very fine tipped ones. And for a tick tool, you follow the instructions on the tick tool. And for the fine tipped tweezers, you grab the tick as close as possible to your skin and pull it straight up. A lot of the tick twisters, tick tools that you can buy, they have instructions, and they're like a little fork gadget. So you put that underneath the tick and slightly rotate it and then pull it upwards. But it's really important to correctly remove a tick. And
are they more prevalent in woodland areas?
Well, that's the normal place we would normally see them. Woodland areas, bracken. They like damp, moist areas. And of course, climate in general is becoming warmer but damper. But over the last few years, they have been found in urban parks, and in some cases even in gardens that have long grass in them.
Now, is the bullseye thing? How common is the bullseye rash?
Okay, so everybody thinks of Lyme disease and the typical rash. So the first thing to remember is not everybody gets that rash, and nobody really knows the true rate of who gets one, but quite a lot of people do not produce the rash. And the other thing to think about with the rash is that although we know the bullseye rash, it can be atypical in appearance. It can be a flat rash. It can be a bruise-like. It looks different on darker skins, which is important. The main thing about the rash, if it does occur, is how it behaves. So it's generally delayed in appearance after a tick bite. It doesn't happen straight away. It can take between 3 days and 3 months to appear, and it will slowly spread outwards. That's the typical nature of it. It generally doesn't itch, or it generally isn't painful. So it's got some fairly typical things that go with it.
We're talking to Julia Knight of Lyme Disease UK, and ticks and woodland areas and the rash that may go with it. And at the back of all this, Julia, this can be life-threatening, can't it?
Well, the thing is, Lyme disease can be treated with antibiotics if it's diagnosed and treated quickly. The problem is when it gets missed or it's not treated adequately in the first place, it can go on to become a very debilitating, life-changing illness. So prevention is key, really. This is a preventable disease. So I've got a list of prevention tips if your viewers would like to hear them.
By all means. The other thing I just want to point out, you mentioned it was Lyme in Connecticut, and they thought, first of all, that children there had got childhood arthritis when they got it, didn't they?
That's exactly correct, because quite a proportion of the community of the children were presenting with an illness with arthritis-type symptoms, and was just put down to arthritis, and that sort of a juvenile arthritis, but in actual fact it was Lyme disease.
Okay, well, if you give us some, just give us some of the symptoms and then how to mitigate it. That's the word today, mitigate it.
Okay, so the symptoms are if you get a bullseye rash, which is the proper name for it is erythema migrans, erythema redness, migrans migrating outwards. That is diagnostic for Lyme disease in itself, and the doctor should start treatment without a blood test. However, we've already said not everybody gets a rash. Some people don't know they've been bitten because ticks are so small. So what you're looking out for is a flu-like illness. Very commonly, people will complain of a very stiff, sore neck, achy, headachy, generally feeling very unwell. And of course, at the moment, we've got another very serious flu-like illness. So if you come down with a flu-like illness, you would get tested for COVID at the moment. But if that's negative and this persists, and you've been out walking in the countryside, or you've been doing an activity that you think, could it be, you're not necessarily seeing a tick, it is worth thinking about.
How do you get tested for Lyme disease?
So there's a blood test. There's a blood test used in the UK. It's a two-tier system. So the doctor will do an initial blood test, and if that's positive, it's usually followed up by a second blood test, slightly different one. But the thing to keep in mind here is that the testing we currently have looks for antibodies to the bacteria that cause the disease, but your immune system takes a while to manufacture those antibodies. So in the first 4 to 6 weeks after a bite, that test could produce a false negative result because your body hasn't made those antibodies yet. And that's another way a case can be missed, because the blood test negative, you must be fine. So it's really important to be aware of that.
Okay. Julia, what's your website?
LymeDiseaseUK.com, and we're on every social media platform. There's lots of prevention material. You can contact us via all the platforms. Somebody will answer you if anybody's got any queries. Okay,
we wish you well. Julia, thanks for being with us today.
Oh, you're welcome. Thanks.
All right, 19 minutes past 12, the Man in Line on Manx Radio through till 1. And we were talking about Lyme disease, just something that's around and about and with woodland areas on the Isle of Man, something to be aware of. That website again is LymeDiseaseUK.com. Lyme is with a Y.